Good morning, friends. Today we are starting postgraduate medicine, and in this we will try to put one questions every day and try to answer it with appropriate explanation. So the question number one: a 54-year-old veterinarian presents to emergency department 3 days after sustaining a deep white over his left arm from a rabid dog confirmed by laboratory testing. He had completed a full pre-exposure rabies vaccination series 10 years ago but has not received any booster since then. On examination, there is a healed punctured wound without sign of infection. He is immunocompromised due to rituximab therapy received 3 months ago for lymphoma. Now the question is, what is the most appropriate rabies post-exposure prophylaxis in this patient? Options are A. No treatment required because he received pre-exposure prophylaxis. B. Rabies vaccination on day 0 and 3 only. C. Rabies vaccine on day 0, 3, 7, 14 without rabies immunoglobulin. D. Rabies vaccine on day 0, 3, 7, 14, 28 plus rabies immunoglobulin. E. Rabies immunoglobulin alone. Let us see how we have to approach this case. The key issue here is rabies exposure in previously vaccinated but currently immunocompromised patient. So step 1 for determination of vaccination is exposure risk. So this is category 3 exposure. Patient has got a deep bite. Rabid dog is confirmed and that bite had occurred 3 days ago, which means post-exposure prophylaxis is mandatory in this patient. Now comes second thing for consideration about vaccination. What is history of prior vaccination or prior vaccination status? He completed pre-exposure prophylaxis 10 years ago. Normally for previously vaccinated immunocompetent person, we give rabies vaccine post-exposure prophylaxis, rabies vaccine day 0 and 3, and in them no immunoglobulins are given. This is as per WHO CDC guideline. So the patient has deep wound, confirmed rabid dog, so he needs post-exposure prophylaxis. And then what is guideline for post-exposure prophylaxis in category 3? If patient is previously vaccinated, give only rabies vaccine day 0 and day 3. No immunoglobulin has to be given. However, in this patient, there is a third point or third issue. He is immunocompromised. This patient received rituximab 3 months ago, which causes beta cell depletion, impaired antibody response. In immunocompromised patient, guidelines state treat them as unvaccinated regardless of prior vaccination history because prior immunity cannot be relied on immunocompromised state. So recommended vaccine post-exposure prophylaxis in this patient is immunocompromised, which is equivalent to not vaccinated, category 3 wound. In this, both combination of active and passive vaccination has to be done. So rabies vaccination will consist of 5 doses: 0, 3, 7, 14 and 28, and rabies immunoglobulin infiltration into the wound has to be done in this patient. Serological confirmation for the response can be done and it can be awaited. So dear friends, in this question The correct answer is rabies vaccine on day 3, 0, 7, 14, 28 plus rabies immunoglobulin. Answer D. Thank you very much.